Good morning. We are going to talk about the different drugs. But remember, in pharmacology, you must know your calculation, legality questions, how to check your patients before you give medication, and how your injection sites are. IM, sub-Q, IV. You all should know your sites and injection, what are the needle sizes are. Make sure we all know about your exams. I will start. There are 7 packages now I gave you. I will add some more, but the first package I'm going to do it, which is with the insulin. And we all should know the first page is small. There are 2 sections. There's a type of insulin, rapid acting insulin, short acting insulin, intermediate insulin. Then in the second box, you have long acting insulin. And in the last is pre-mixed. I added this box so you can see there are pre-mixed, and they have Humulin in the first box, 70-30. And Humulin is pre-mixed, 30 minutes, it works. And Novolin, 30 minutes. Novolog is very fast. It works within 10 to 20 minutes. Humalog, 50-50. That means they're mixing 2 medication in there, and Humalog mixed medication. So please look that the word is pre-mixed. You don't have to mix, they are already mixed, but the action. I will move on page next one. With this one you guys have with the insulin, and I want you to highlight main wording. The first one is rapid acting insulin. In rapid acting insulin, remember the word Humalog and Novolog. Whenever you see in a premixed Humalog and Novolog, they're rapid acting. And how long does it take to work? Within 15 minutes. It says in the second box, 5 to 15 minutes. In the last box, I want you to highlight the word, when do you give your patient the tray, foods they must eat within 15 minutes. So remember, your answer should be within 15 minutes. If you take it longer than 15 minutes, we will be wrong in our answer. Second one is called short-acting insulin. What is a short-acting insulin is your regular. And what is regular is called Humulin and Novolin. Whenever you see Humulin and Novolin, and remember the word R. And that is your regular. You must know your name of your insulin. And when does the onset? 30 minutes to 60 minutes. The third box, I want you to highlight the word where it says 2 to 3, and I want you to write down the regular insulin. Peak is 2 to 4. Very important. We all should know 2 to 4. And last box, you will go, when do you give tray when you are giving regular insulin? 20 to 30 minutes. So underline the word 20 to 30 minutes. No longer than 30 minutes. Remember, is regular insulin, your patient must eat within 30 minutes. And it is given alone, or you can mix it. And also it's clear. Regular insulin, highlight the word clear. So everyone should know this is clear. And I want you at the end of the box, write down, how do you give regular insulin? You can give IV. When do you give IV? When your patient has DKA or hyperglycemia. Very high, and remember, type 1 patient. So write down that. So your answer will clear. When do you give regular insulin IV? When your patient has DKA. Which patient has DKA? Type 1. And how do you give them is IV. How do you give sub-Q? Write down the word sub-Q. You are giving on sliding scale. Write down the word sliding scale. Some of your question, when patient is type 2, and they are NPO, and they cannot take oral medication, how do you treat them? You are giving regular insulin. How? by sliding scale. Everyone is okay? Any question? Your patient is type 2, they are in surgery, you are not giving any food. How does you give your pills? You can give your pills, so how do you treat them? By giving sub-Q. Another word, how do you give your regular insulin is by sub-Q, and you can give them by IV. Everyone is all right? And when do you give your patient to eat? 30 minutes. What is the peak hours? 2 to 4 hours. Now, if they give you a question, you gave regular insulin for your patient, sub-Q, and you gave 8 a.m. What time is your peak hour? What is the meaning peak is? Patient is hypoglycemic. So when is, remember, peak means they're asking you hypo. They didn't use the peak word, and they said, when do you monitor your patient for hypoglycemia? Now don't go 4 hours, immediately 10 a.m. because their sugar is already going down. So when do you monitor your patient for hypoglycemia? 10 o'clock. Everyone is okay? But if they say, what is the peak hour? Then you're going to say is what? 2 to 4 hours is your peak hours. Now, third one is NPH insulin. What is NPH insulin is called intermediate insulin. And highlight the word lente, L-E-N-T-E. Now, sometimes they use the word lente. So lente is your insulin is intermediate. The meaning is it doesn't work too fast right away. It takes a longer time. And look in the first box, 2 to 4 hours. So it doesn't matter if patient ate or patient already ate. So they're not going to ask you about the tray. But they will ask you, what is the peak? I want everyone must know your NPH is your peak hours is what? 6 to 12 hours. And when you are monitoring for hypoglycemia, first is 6 hours, or write down underneath 3:30 p.m. to 7:30 p.m. is good time you're monitoring for hypoglycemia. So write down both the volume. Now I want you to go in the last box, and it says is white and cloudy. Which insulin is cloudy? Your NPH. Can be given after meals. You can give them. And what time is their hypoglycemia? Everyone should know 6 to 12 hours. So if you are giving NPH 8 a.m. and they're saying, what are the best time you monitor your hypoglycemia with NPH? They gave you 10 a.m., they gave you 2 a.m., they gave you 9 p.m., and 12 midnight. So what would be the best answer? Would be before 3 p.m. If you're taking 8 o'clock, 9 o'clock, patient is already hypoglycemia. So remember, what is the best time is closer to your 6 to 12, you go for 6 hours, and round figure, keep it in mind, early evening time, 3 p.m. to 7 p.m. would be around that time. And what do you teach your patient here? To make sure eat something before they do any exercise. What do you check before you exercise? Sugar. What do you eat before maybe take a snack? Because why? If you're going for exercise 4 p.m., patient blood sugar is already low. And when you exercise, what happens? Your sugar is going to be low. So remind that is on NPH. What is NPH? Intermediate insulin. What is the peak time of NPH insulin is 6 to 12 hours. Ultra-lente is a long-acting insulin. They won't ask you, what do you monitor? Because it takes peak 12 to 16 hours in the third box. Go in the last box used to control fasting blood glucose. What is it controlling here? Blood glucose. Then we go in the last box is called lentus, and highlight the word lentus is continuous and very long acting, no peak. The meaning is they don't go hypoglycemia. No peak means no hypoglycemia. And go in the last box maintain the blood glucose. It maintains the blood glucose, and regardless of meal, cannot be mixed with any other insulin. Do not mix it with other insulin. The best time for them to give Lantus is at bedtime. Everyone should know is bedtime you can give them, and mostly you're using Y is your insulin R for type 1 and type 2 patient. In herbal interaction, in the last box, make sure you start knowing your herbal. Ginkgo glucosamine may interfere blood glucose, and they increase the blood glucose. And garlic underneath, and also echinacea and ginseng may decrease the blood glucose. So those are garlic, if you're taking, that can decrease the blood sugar. And glucosamine is very high in also sugar. Second page, let's move on. Next page is, you have page number 2 on this package, is anti-diabetic medication. And you're giving for oral. Which one do you give oral? Type 2. So make sure we all know. Now, I want you to memorize the wording. It says the first is sulfonylurea. And what are the medications we have here? Is Ambrol, glucotrol, and micronase. Those 3 drugs are. What are the main side effects of that are GI, diarrhea, and dermatological means rashes. So I want everyone, for your oral medication, we had the Spider-Man package when we did, and you had 2 side effects are your diarrhea and upset stomach and rashes. Number 2, glucophage. When you're giving glucophage, in the 3rd box, I want you to underline, monitor, not given if renal impairment. If they have kidney problem, you do not give them. So glucophage, very important. What are you monitoring? Kidneys. Just highlight that word. Acrobose, very important. You all should know for your exam. And is called is alpha glucoside inhibitor. Side effect is diarrhea. Avendia, next medication. Prendin, very important. Everyone should know the word glucophage, Pericose, Avendia, and Prendin. Now remember, when you are giving, I want to underline the word action. In action, you guys have functioning the beta cells. What does it do? Stimulate insulin and releasing. From where do you get insulin? We all should know the beta cells. And pancreas and increase insulin, there are the packages if you want it, is insulin receptor. So you must monitor is functioning the beta cell. And type 2 you are giving. Underline the side effect, diarrhea and skin reaction. And nursing consideration. In nursing consideration, in the next box, it says avoid alcohol. And go underneath good skin care. We all know skin care is important for your diabetic patient. Are we clear? Herbal, ginkgo, glucosamine is increasing, garlic, and ginseng is decreasing. So those are, take the whole packages, on whole package. And so those are your oral medication. Next page, we will go anti-thyroid. When they give you the word anti-thyroid, write down the word hyperthyroid. Which patient is you're giving anti-thyroid? Hyperthyroid. And what is another name is called for hyperthyroid? Graves' disease. And what are the names of medication are? PTU, number 1. And PTU is called prothyracil. And next is called tapazole. Everyone should know. Second box, side effect are sore throat and fever. And last box, you will go and highlight the word. In the 3rd line, check CBC. Why? Because CBC is affected. And that's 3rd box, the last line, fever, sore throat, if patient has, you need to report to the physician. Second box, Lugol solution and potassium iodide. So they give Lugol solution of potassium iodide, that's for thyroid and anti-thyroid medication. Second box, highlight the word metallic taste is important. Third box, second line, use 2 weeks for why? To decrease vascularity and decrease hormone. And then you skip another line, then you go dilute. How do you give this? It's a solution. You mix it with water, mix it with milk, and with the fruit juice. And how do you give them? Through the straw. And it's important to prevent staining. And the third one is called radioactive iodine. And what is the side effect is metallic taste. Underline that word in the second box. I want you to go in the last box and in the bottom line. I will start from the bottom in the last. Full radiation precaution. What do you need here? Radiation precaution. And increased fluid. And urine and saliva vomiting contain radioactive for 3 days. So make sure you are taking precautions. Those are important things everyone should know. Your PTU and tapazole, I want you to write down on the side. Those drugs are also given for complication of thyroid storm. Write down on the side. It's an anti-thyroid medication. When you had thyroidectomy and patient has thyroid storm, you give that medication also. So in your question, what drug do you give for thyroid storm? Same, PTU and tapazole. I will move on to the next page. In the next page, you will leave the first box and go to the second box and say thyroid replacement. Now, which patient you will give thyroid replacement? Hypo, write down the word, and thyroidectomy. What is hypo or mixed edema? So remember, hypo people need hormone, anti-thyroid you're giving for which patient? Hyperthyroid. And what do you do for your patient is number one, medication is levothyroxine. Levothyroxine is another one, Synthroid. Take the package. There are the packages there. Synthroid, and what is the side effect is here on Synthroid? Tremor, insomnia, no, not like that. The whole package, just pick up the whole package, yeah. Tremor, insomnia, palpitation, and dysarrhythmia. And go on the last line. It says, tell the patient to report chest pain, palpitation, sweating, and nervousness, and shortness of breath. So make sure Synthroid you're giving, you tell the patient. Why? Because you're giving in hypo. In the first package, page number 4, and anti-thyroid replacement you're giving for patient after thyroidectomy and hypo patient. And what do you check is the pulse. Second box, you have cytomol. Cytomol, everyone should know cytomol, everyone should know Synthroid, and go in the last box. When do you give this medication? Given in AM. What do you monitor? You monitor for pulse and blood pressure. What is it increasing? BMR, inaction. Everyone should write down the word BMR. What is BMR? Basal metabolic rate, BMR. Everyone is okay, BMR is the basal metabolic rate. Next is, I will move on to the next page, is called glucocorticoid. Glucocorticoid are your steroids. Where do you get glucocorticoid are? Write down on the top, adrenal gland. And what is it called? Adrenal cortex. So where do you get the steroids are? Adrenal cortex. What are we calling here is the adrenal cortex. Adrenal cortex is your main part, you're getting the steroids. Next is, in the first box is, you have the word hydrocortisone and dexamethasone, decadron. Then next is Solone word. I want everyone remember all your steroids are zone, S-O-N-E, and Solone, S-A-L-O-N-E. Solone and S-O-L-O-N-E are zone. Everyone is okay. Where do you get the steroids from? Adrenal cortex. Ending word is zone and Solone. Whether it's say inhaler, whether it's an eye drop, all your steroid, when you have zone and zolone, you know you're giving steroids. Now I want you to go in the third box and highlight the word in third box, used for adrenal insufficiency. And overdose, you are turning your patient into what? Cushing. So highlight the word in the third box, Cushing. And remember, abrupt withdrawal. You cannot stop your steroids all of a sudden. Why? Underline the word Addison crisis. And what does the patient has? If you stop the steroid, they're turning into crisis. What is the best time you give steroids are 9 a.m. Those are very important. Let's go in the middle box. So everyone is okay. Why you're giving steroids are is best time you're giving 9 a.m. What are you turning your patient when you give steroid? They're turning into Cushing, and you don't stop, otherwise they're going into Addison crisis. And why do you give steroids? I want you, everyone, to write down. You do have is underneath, if you go 9 a.m., give multi-dose in a spread interval. Infection may produce few symptoms due to anti-inflammatory action. But I want you to write down on the side, why do you give steroids? Your answer is to reduce inflammation. What does it do? Reduce inflammation. You can give any patient, ICP patient, infection patient, but what are you reducing here? When you are giving us steroids are reducing inflammation. You are not only giving Addison, but you are giving all your patients, rheumatoid arthritis. Any patients, and what are we reducing here is inflammation. Now second box is infection. What does it increase here? In the second box, highlight the word infection. Third line, edema in the side effect. Everyone should know. What are the side effects of your steroids are is infection, edema, and euphoria, delayed wound healing, and hypokalemia. I'm writing is there, hypokalemia, hypocalcemia, and hyperglycemia. So what happens when your patient is going in Cushing? Write down like that. They increase sodium, they increase sugar, they increase blood pressure. What is low here? Potassium. And what is low here? Calcium. So you do have in the box, what is it reducing here is the calcium and the potassium. What is high here is the glucose, and what is high here is your sodium, and what is high here, the blood pressure. The packages are in the box here, so you guys just pick up the whole package, okay? Now, next is, I will move on, is you are giving to all your patients to treat them, is your patients. So we have 7 packages. I finished the first package, so take a whole package from the box, yeah. Complete package, just complete package. Can you stop for a minute? Can you stop for a minute? And we will move on number 2 package is antihypertensive. So let's go on antihypertensive. Very important this package is, and make sure you all memorize. Antihypertensive medication, you have on the first page, it says antihypertensive and is centrally acting alpha adrenergic medication. Catapres, Aldomet, your medication are, and you're giving for patient. And which patient are you giving for hypertension in the second box? And next is which patient you're going, what is the side effect are? Everyone should know is orthostatic hypotension. And CHF. What is CHF? Edema. Write down. Anywhere in your question, you're giving a blood pressure medication. Patient has edema, that's a side effect, that's not good. And what do you teach them? Don't discontinue abruptly and monitor for patient with fluid retention. Another antihypertensive medication are is hydralazine, and that's also given for hypertension. I want you to move on page number 3. Now on page number 3, you have, which is on the second medication, ACE inhibitor. Everyone should know ACE inhibitor. So we are talking about the blood pressure medication. What is the ACE inhibitors are is write down and highlight the word capotril and write down the word your ACE inhibitors are. What is ACE inhibitors? Pril. Everyone remember the last wording. All your prils are ACE inhibitor. And what do you monitor your patient with ACE inhibitor is pril medication, and highlight the word angiotensin converting enzyme. What is it? Angiotensin converting enzyme. So how does it work? In action, go in the action, blocks the ACE in the lungs and converting, underline the word angiotensin 1 to angiotensin 2. So what is pril is? Everyone should know angiotensin 1 to angiotensin 2, they convert, and where? In the lungs. And very important is, pril is your blood pressure medication. Everyone is okay? And what are they converting here? Angiotensin 1 to angiotensin 2 in the lungs. That's enough to know. And you're giving for high blood pressure. What are you monitoring is, go in the side effect, proteinuria. In the box, fourth one, side effect. You have a lot of them. I'm going to have highlight main one. And if you memorize all of them is good. But proteinuria, rash is important. And I want you to write down, pril is very important, hacking cough. Cough is very, number one, your answer. Everyone should know. If patients start cough and they use the word hacking cough, dry cough, patient is having. Second one is fever. I want you write down, and rashes, you already write down the word, and proteinuria, and low blood pressure. Yes, it will cause low blood pressure, but any patient you start on pril and they start dry cough, doctor need to stop and we need to notify the physician. Everyone is okay? What is pril is called ACE inhibitor. What are they converting here? Angiotensin 1 to angiotensin 2. And what do you monitor your patient? I said highlight in side effect, proteinuria, rashes, and I said add there in your notes, hacking cough, very important, and fever and rashes. Now what do you teach patient? Nursing consideration, decrease absorption. If taken with food, give 1 hour before or 2 hours after. So don't take it with food. Why? Because it lowers the absorption. Then last 2 line is given. Also you tell the patient get up slowly. Why? Because orthostatic hypotension can be used with thiazide diuretics. That means you are giving diuretics to lower the blood pressure, and pril is okay to use with what group of thiazide? Is the group of the diuretics. Everyone should know, very simple. For example, pril are your blood pressure medication. Where does it affect here? In the lungs. What are they converting? Angiotensin 1 to angiotensin 2. And what are you monitoring? Side effect is hacking cough. I will move on. Another group is called beta adrenergic blocker, which is called beta blockers. And what is the last ending word of blockers are? Atenolol, olal. Olal are your beta blockers. So highlight that, write down on the top. You don't need to memorize the name, but if you know beta blockers, anyone comes is olal. If you can memorize all the name, very hard on exam, but remember, is your ending word. Pril is your blood pressure medication. Olal is your blood pressure medication. And these are atenolol, all that olal word are. Tenormin, that is another name. And where does it affect? Underline action. Blocks beta adrenergic receptor decreasing excitability of the heart and reducing the cardiac workload and oxygen consumption. And next is indication. Where can you use beta blockers? I want you to highlight the word second line, angina, chest pain. We all know nitroglycerin, but not only nitroglycerin, we can use the blood pressure medication, beta blocker. And also go in MI patient. You go on the fourth one. The next one, migraine headache. You can give them on migraine headache. So very important, MI, angina, and headache. When you're having headache, you can use that medication as the blood pressure medication. Side effects are very important. Second one, bradycardia. It lowers the heart. It says bradycardia and tachycardia, but very important, highlight bradycardia. Half of your question would say check the pulse before you are giving, because it affects the pulse. And cardiac dysarrhythmia and CHF. So second, third, and fourth. And so what do you, nursing consideration, what do you teach your patient when they're taking beta blockers is oral medication, or don't stop abruptly. Tapered it down, because what happened, all of a sudden you stop, patient can go in hypertensive crisis. Are we clear? So what do you teach in teaching question when you're giving beta blockers? Don't stop all of a sudden. And number two, take with meals. And I want you to add there, you monitor for what? For your patient is the pulse. So what do you check before you give? Everyone should know beta blockers. We all know blood pressure. But when you are saying oral, you must check the pulse because it causes bradycardia. Diabetic patient, go on the fourth line. Monitor hypoglycemia because it affects the sugar. So also monitor the blood pressure and sugar. Let me repeat, everyone should know oral. Oral is your beta blockers. And what do you monitor here? The pulse, which is very important. And second thing, everyone should know, do not stop the medication all of a sudden. Next page, we will move on. You have another group of medication is calcium channel blocker. And calcium channel blocker, like medication, you have Procardia, is called PINE, P-I-N-E. Some of the would say calcium channel blockers have PINE word at the end, but not all of them. Verapamil and Deltazem. Why do we use them? And how does it work? Calcium channel blocker inhibit movement of calcium ion. So remember, has to do something with the calcium in your answer. What is inhibiting calcium ion? And also is affecting the cardiac and arterial muscle. Indication, when do we give your medication, calcium channel blocker? Now you're giving hypertension, underline the word angina, and the last line, you will go in indication, migraine. So remember, some of your medication, your blood pressure medication are used also for chest pain, migraine, and this. That is your calcium channel blocker. Side effect is headache, and underline the word peripheral edema, bradycardia, and the last one, impotence. And write down the word constipation. Constipation you have. Now there's another group of medication on blood pressure you don't have in the packet, so I'm going to add there. It's called angiotensin receptor blocker. Now people who are allergic with prill, they give them this, angiotensin at the last one, receptor blocker. And their medication ending word is called sartan, S-A-R-T-A-N, sartan. So all your sartan. For example, I'll give you one word, losartan, L-O-S-A-R-T-A-N, which is called Colzar medication. So this is your sartan. Another, so we have Pril, I said we have Olal, and we have Sartan. Sartan ending word is Sartan, just like losartan, and Cozart, that's the same medication, and that's also your blood pressure medication. What do you monitor when you're giving Sartan is, number one, side effect, I want you to add there, is insomnia. They cannot sleep. Insomnia, you can write it, and it can call arterial ventricular block. They can also call depression, side effect of this, and cough. What lab do you do? So always check the blood pressure when you're giving medication. And number two, kidneys, BUN, and creatinine, very important. And increased fluid, hydration is important, they are hydrated. That means they must drink fluid. I won't say the word increased fluid, hydration word is important. They don't get dehydrated, it's not good. So, Pril word we said, oral medication we said, calcium channel blocker we said, and the other medication are Sartan. So everyone should know Pril, oral, Sartan, calcium channel blocker, all your blood pressure medication. Any question with the blood pressure medication? What do you teach your patient? Everyone knows. It lowers the blood pressure. I said beta blocker, you check the pulse, very important. And also remember, what do you teach in another teaching? Because it's a cardiac. What do you cut down? Salt in your patient and the fluid, because it retains more fluid. That is in your cardiac question. Next page, we'll move on, digoxin. And everyone knows must know your digoxin level. And next is digoxin side effect. What are the side, and what is it called? Cardiac glucoside. So if they give you what is cardiac glucoside medication is your digoxin. And digoxin is also called lanoxin. Now, when you're giving digoxin is, number one, anorexia, side effect. They have no appetite. Number two, nausea. Number three, bradycardia. And visual, very important, visual. And visual means they can see and they have halos around the eyes. Now, I want you to go in the third box. When you're giving digoxin, is you must monitor the pulse for 1 full minute. Notify physician if apical pulse in adult less than 60, infant 90 to 110 less than, you don't give. In older children less than 70, even you don't know the grouping, that is in the third box. And the last line, I want you to underline the word low potassium. So what are you losing when you're giving digoxin? You're losing potassium. Everyone is okay? Anorexia, number one. And number two, remember, is bradycardia, lower the pulse rate, visual. I want you to underline the word action. What does it act? Slow the heart rate, increase the force of myocardium contraction, and it's slowing the heart rate. And where does it affect? The vagus nerve. So what is it doing? Digoxin. The purpose of digoxin, it's stabilizing the heartbeat and it's slowing. Now, side effect is very important. Anorexia, second line, halos around the eyes, do not forget, and also monitor for digoxin toxicity. Everyone is okay? That's digoxin. You must memorize anorexia, lowering the potassium, lowering the heart rate, and affecting the eye. Next is anticoagulant. Next page, we'll move on. Page number 6, you guys have anticoagulant. What is anticoagulants are? Your blood thinner. And what are the anticoagulants are? Heparin. And what does heparin cause here is second line in side effect are tissue irritation, injection site, monitor for irritation. Sometimes they use word anemia, and why? It lead to thrombocytopenia. What is the meaning is bleeding, low platelet count. What is thrombocytopenia? Low platelet count and patient is bleeding. Last box, you will go the lab. What are the lab is partial thromboplastin time, PTT. 1.5 to 2.5 is the control. Normal is 20 to 45 seconds. Then is you will skip to line, then you go for injection. How do you give them? Only sub-Q and never IV, and I want you to, never IM, but write down there IV. So how do you give heparin? On the side, everyone should know sub-Q and IV. No IM. Everyone knows sub-Q you are giving, IV you are giving, and you can give them is never IM. And antidote, last line. Everyone should know the lab. How do you give this medication? Protamine sulfate. What is it? The antidote is in the last box. It says within 30 minutes, when patient is bleeding and risk for bleeding, and their lab is off, you give them protamine sulfate. Second box you will go on is called Lovanax. Lovanax is another blood thinner. And how do you give? It's same as heparin, but you do not give IV or IM. It must be given in the third box, second line, only sub-Q. So how do you give Lovanax? Is only sub-Q. Not IV, not IM, only sub-Q. Third box, and they have no special tests on Lovanax, but monitor for bleeding same as heparin. The third one you guys have is Coumadin. Coumadin is called warfarin. And how do you give Coumadin? PO, by mouth, only by mouth. So write down, when patients are going home, and a lot of them, when they have cardiac problem, thrombophlebitis, and they're going home, they give them PO medication. Coumadin is given PO. And what do you monitor for Coumadin is also, its PO is diarrhea, rash, and fever. What is the lab you're going to do? In the third box, you will move on, is called PT and INR. PT, INR. PT is 1.5 to 2.5. INR 2.0 to 3.0. I want you to add there more than 7 is risk for bleeding. Patient would start bleeding. Fourth line, you will go, it says antidote. What is the antidote is vitamin K. In the last box, patient food avoid in vitamin K. What do you teach them when they're taking Coumadin? Do not take vitamin K. And what is the vitamin K high? In green leafy vegetable. Underline that. Pork, rice, yogurt, cheese, fish, and milk. So that's important in our teaching. So heparin, Lovanax you have, and you have is Coumadin. That is your blood thinner. How does it act? Underline the word action. It blocks the fibrinogen heparin. How does heparin does? It is blocking fibrinogen to fibrin. Coumadin is synthesizing vitamin K and clotting factor. So just for your few purpose, you write down those, and always you monitor for bleeding. In the herbal, go in the last box. Everyone, those who are, you have your date, and everyone should know some of your herbal medication. In herbal, garlic, ginger, ginkgo increase bleeding time when you're taking with Coumadin. Then third line, ginseng alpha may decrease it, and black haw increase the anticoagulant. Then the last box, you have vitamin C, decrease Coumadin effect. Vitamin E, increase Coumadin. Coumadin, you're taking warfarin by PO. So some of the things are important because bleeding can be affected by some of your herbal medication and the other medication. So we are done on heparin, anticoagulant, Lovanax, and warfarin. And teaching question. Antiplatelet. some drugs affect antiplatelet. In the next page, number 7, such as aspirin, underline the word. In the aspirin, which is called salicylate acid, is aspirin, ASA. And what do you monitor when you're giving aspirin? Underline the word GI bleeding. First thing, and always GI bleeding, number 1 answer. Then prolonged or overdose. If patient is admitted aspirin overdose, then what do you monitor? In the 4th line, metabolic acidosis and respiratory alkalosis. So aspirin overdose, you are monitoring acidosis. And underline the word is last one is ear, tinnitus or hearing problem. So aspirin, very important, GI bleeding, hearing problem, everyone should know. And also, if they take overdose, is what patient is going metabolic acidosis. I want you to write down underneath soda bicarb. You are using for treating metabolic acidosis. So how do you treat them? By soda bicarb. Now, last box, I want you to go there, is bleeding. And the color of the stool, 2nd line, would be dark and bruising. And you can give them always with food, with milk, and also with food. And also, I want you to write down contraindicated. If patient is having bleeding, you don't give them. Patient is anemia, don't give them. Anti-inflammatory effect. So what is aspirin? Not only for platelet, but you are using anti-inflammatory. And where do we use anti-inflammatory? Rheumatoid arthritis. Then you go analgesic. Then you go antipyretic for fever. Number 2, presentin. Presentin is also effect on the antiplatelet. And what do you monitor? EKG. And go in the last box. Give 1 hour before or with meal and monitor for bleeding. Plavix. Plavix is also your blood thinner and also antiplatelet. What do you monitor when you're giving is that epistaxis in the 2nd box, 5th one. GI bleeding. All of them you're monitoring for GI bleeding. And what does it affect Plavix? Underline the word liver study. What do you check? Liver. So how does it work when they're saying antiplatelet? Underline the word interfere with platelet aggregation in action. So sometime in NCLEX they can ask you how does it work. That's why I'm highlighting some of the medication is action. So where does it affect? Is for platelet. And remember, when patient is taking once a day, you are preventing from bleeding disorder. And when you are taking PRN, maybe for other reason. Now next is in cardiac medication. So you must know your blood pressure medication. Everyone should know digoxin. Everyone should know some of your blood thinner. All your blood thinner monitor for bleeding. Give them with the food and don't give them on empty stomach. Next page is nitrates. What is nitrates are? You have nitroglycerin. We all know nitroglycerin. Another word we say nitrobid. You can figure it out. Nitrobid is nitroglycerin. Nitrostat and transderm. Transderm means they are putting on the skin, applying on the chest. What do you monitor when you are giving nitrate? Side effect, 2 are important. Hypotension, 2nd one, and 3rd one, headache. Renew the supply every 3 months. Even you haven't used it, you must change the supply every 3 months because they get bad and they're not effective. Sublingual, you give them line 3, sublingual. Next line, protect them from the light. Keep them in the bottle. And what kind of bottle they have? Nitroglycerin, small brown bottle, and keep it in that bottle and don't leave that in the car or in the sun because it loses the potentiality. So protect from the light and make sure it is under the tongue and it wet with the saliva or water. Number 2 is, a lot of time we all miss, is nitrates are called isosorbide. Isosorbides are. And isosorbide or sorbitrate, when they give you the word isodrill. Isodrill, sometimes we never think that's a nitroglycerin. And a lot of time we miss. And you do have in exam cram questions another. Side effect is same. What do you teach patient when you're giving cardiac medication? Get up slowly. And third box is don't discontinue all of a sudden. What action? What does it decrease here when you're giving nitrates are? Relax the smooth muscle and underline decreasing blood pressure and reducing myocardial oxygen consumption. Indication, where do we use nitrates? Number 1, pain, chest pain, angina. You can also give nitrates for renal disease and patient with hypertension. Side effect we already said. Now I want few lines to underline in nursing consideration. Number 1, take sublingual under the tongue or buccal in the mouth. And you should feel burning or fizzle sensation. If you don't feel burning and fizzle, nitroglycerin is no longer working. Number 2, check the date, expiration. If unused medication, don't keep it and discard it. And then you go on chest, administered topically. Topically means on the chest, 6 by 6 inches area, and cover with plastic wrap. There is a plastic word. Make sure you cover with plastic and rotate the side. And always administer transderm where you have less hair, and always use the gloves. Those are very important that we all should know. Everyone should know nitroglycerin comes under the tongue. You have nitroglycerin is a spray. You can put it in the mouth, and you can also put it on the chest. Everyone remember the word with nitro is isodrill. Are we clear? And don't give nitroglycerin medication along with what? With erectile medication like Viagra, because both of them are vasodilators. So remember, nitrates are never given with for erectile for men medication, because they both are very hypotensive medication. Next page, we'll move on, is antilipemic medication. When they use the word antilipemic, means your cholesterol medication. When we are giving on page number 9 is antilipemic medication, the first group is called bile acid and squesterant. They call the word squesterant, and the medication is cholecystamine or questerant and cholistate. Underline the word cholistate and questerant. Please be sure, we all know that also lower the cholesterol and the fat, antilipemic. Constipation, side effect is constipation with bile medication and third one, highlight the word fat-soluble vitamin deficiency. Because you may be, and we all know what are the fat-soluble vitamins are, A, D, E, and K. A sprinkle on the food. What do you do? Sprinkle it, let it on the beverages, and administered 1 hour before or 4 to 6 hours with other medication, because it will cause a blocking absorption. Everyone should know squesterant word is your bile medication for cholesterol, and you monitor for fat-soluble vitamin. Rashes, constipation. Second box, you have HMG, and everyone should know common medication we use for cholesterol. The word is called a statin, and it says lovastatin. Underneath, Mevacor, Prevacol medication are. So what is the main cholesterol medications are? A statin. So write down on the side, when you see the word statin, that's your cholesterol medication. The first one was squesterant, but that's a statin is your another group of your medication. What is the side effect of your statin are? In the second box, myopathy. What is myopathy? Muscle. I want you to write down is on the top is the muscle pain. And what do you monitor? Second thing is both word is important, liver. Before you give your cholesterol medication, what lab you should do it? Liver function test. If they give you a question, patient has liver problem, you cannot give a statin. Go in the third box is take it with food. Absorption is reduced, taken with food, reduced 30% on empty stomach. Contact clinician. You talk to the doctor and give them unexplained. Let him know. Patient has muscle pain. Patient says, I cannot walk. I'm having a lot of muscle pain. You cannot give a statin. Underline, especially with fever and malaise. Patient has fever, patient has malaise, you cannot give them the statin medications are. So everyone should know the word is statin, and statin word means are the cholesterol medication. And I want you to add on the side is, the word is called is muscle, and sometimes they use the word wasting. Muscles are wasting. Muscles are getting weak. Myopathy, everyone should know. Two things everyone remember for your statin are muscle and liver function test. You cannot give a patient has a problem in the liver. And write down on the side once a day. You give them once a day. What is the best time you give once a day? In the night time, after dinner. So they must take it after dinner. Patient should not be, is getting with the statin or is avoid them giving the medication is grapefruit juice. Don't give them the grapefruit juice. Take it from her. Is avoid them is giving the medication. Number 3 is niacin. Niacin is over the counter. When you're giving niacin, is for lowering the cholesterol. And it's also called nicotinic acid. Nicotinic acid, a lot of people take it over the counter and take it to help them lower the cholesterol. Underline the word, when anybody is taking niacin, we are on the package with antihypertensive medication. And on page number 9, and cholesterol medication. What do you monitor patient with them? Hyperglycemia. So when you're taking niacin, what are you monitoring? Hyperglycemia. Gout, it can affect uric acid and liver. And also go in the third box. It is used for pellagra and peripheral vascular disease. So niacin is also in your vitamin chapter. I gave you guys in GI, and in vitamin, very important for pellagra is and peripheral vascular disease. So everyone is okay? Is Questorant is one of them, that's a bile medication, and is statin. A statin, you give them nighttime after dinner, monitor for liver and muscle weakness, that's important, and check liver function test. Action, how does your cholesterol medication work? In action, inhibiting cholesterol and triglyceride. What is it lowering? Triglyceride. And decreasing what level? Underline the word LDL. What is LDL? Low density lipid, which is the bad cholesterol, low density lipid. So it's reducing LDL. Now, next is indication. Which patient do we use when you have LDL, cholesterol is high, and also in third line, myocardial or cardiovascular disease. Nursing consideration. Highlight the word lab should be done. What are you checking? Lipids every 6 weeks. And also write down, check the liver function test. Are we clear? So those are lipid medication. Now, next page, I will move on page number 11. I will skip the 10-1. Benadryl will be talking another page. So let's go on page number 11. it says anti-dysarrhythmia medication. What is the meaning anti-dysarrhythmia? When the heartbeats are very high and they are either high or low, you got to correct those dysarrhythmia. Abnormal heartbeat. What are the medication are? Is lidocaine and xylocaine. Now lidocaine is used for which patient are for hypotension, underlined side effect. So it is used for your patient in the third box, but side effect is check the blood pressure, hypotension. And then you go in the bottom and highlight the word drowsiness and dizziness. So drowsiness, dizziness, blood pressure. Why do you give lidocaine? Underline the word premature ventricular contraction. So ventricular dysarrhythmia you're using is lidocaine. And keep CPR. Whenever they're saying ventricular problem, what are you monitoring here? Is the monitor for your patient for blood pressure and BUN, underline the word, and creatinine. And when we are saying ventricular problem, that means you monitor your patient is you're giving CPR. So keep them ready for your CPR and you be prepared to start the CPR. What do you check your patient are BUN and creatinine. Here, take it from the pages. Is BUN and creatinine you monitor. So everyone is okay whenever you have a cardiac problem, what are you monitoring here? Is the renal. You must check the renal, you must check the BUN and creatinine. Next is Procan SR and Pronestil. Is you're giving is monitor for hypotension, bradycardia, and what do you monitor in the last box? Atrial and ventricular is your patient contraction. Monitor potassium. Then you go monitor blood pressure. What do you check patient here? Is the pulse. Quinidine is the third medication. What do you monitor when you're giving quinidine? Is again your hypotension. Which patient are you giving? Ventricular arrhythmia. So quinidine, xylocaine, very important. All these medications you're giving when they have dysarrhythmia. What do you monitor? All of them. Hypotension, side effect, and also you go in the third box is liver function test. Check apical and BP and check EKG. All your cardiac medication, you must do EKG and assess your patient. Next is called beta pace or SOTAL, SOTALOL, also for ventricular arrhythmia. Cardaron is also your arrhythmia medication, R. And what are you checking here? Is baseline pulmonary, thyroid, and liver function test. And side effect is, in the middle box is hepatic, means liver, and photosensitivity. Now remember, is side effect are, whenever you are checking your patient with cardiac medication, how do you know they're working? Check their heartbeat, check their EKG, check their urine, and when they're having good urine output, you're checking potassium levels. Simply remember, but you got to know some wording. Your lidocaine, your Proscar, Pronestil, quinidine, and your Cardaron medication are. Next page, you move on. On the second, on the page number 12, is some of your medication in shock, cardiac arrest, and anaphylactic reaction. What medication do you use? Levofed, which is called norepinephrine. Which patient you will give? Now you're giving when your patient increasing the blood pressure. So what happened to the blood pressure is low. Otherwise, for dysarrhythmia, this is your blood pressure medication, such as Levofed, norepinephrine, and third box, increasing blood pressure, and also cardiac output. Bradycardia may occur. Check urine output. The last box, check the blood pressure. And in second box, you go nervousness, palpitation, and headache. So everyone, norepinephrine is given to increase the blood pressure. Dopamine, you're giving to increase blood pressure. Where do I talk about dopamine? In patients with MI. When they have a heart attack, you can give dopamine. And it's also called inotropine. And go on the last box is headache is early sign of the drug is excessive. Monitor blood pressure, monitor urine. All your medication, you must give them by pump. And epinephrine. Epinephrine is given for anaphylactic reaction, adrenaline. Side effect is in the middle, nervousness, restlessness. What do you monitor when you are giving epinephrine? Blood pressure. Always check the strength. You can give epinephrine IM, you can give sub-Q, you can also give IV. Always check the strength. 1 in 100 is inhalation. 1 in 1,000 you can give sub-Q or IM. So it is your epinephrine, IM, sub-Q, you have here, and inhalation. Isoprel is also used for heart block when patient has in the third box ventricular arrhythmia. And what do you monitor? In the second box is third line tachycardia and the blood pressure. Now Sudafed is more, also can be used for allergies or anaphylactic reaction, dry mouth. The last one, you guys have neosporin, and that also can be used, and when you're using, it can cause rebound nasal congestion. But everyone should know, Levophed, dopamine, epinephrine is your anaphylactic medication. Some of your dysarrhythmia medication we did on page, is on the previously. The last page on 13, you have your blood thinner. We talked about that. This is thrombolytic medication. What is thrombolytic medication are? Is they dissolve the clot. And what are the name of medication are? Underline the word is retavase and activase or alteplase and TPA. TPA, we all should know, activase. And what is the side effect are? It's a thrombolytic, is bleeding. TPA is normally occurring enzyme. And second box, you have streptokinase. Streptokinase, we always talk about it, TPA and activase. Those three names, at least we should know. When they're saying thrombolytic medication, you are giving an action. What is the action here? In the box, you will go break down plasmogen into plasma and dissolve the fibrin. And when do you give them? As soon as patient comes, you should give them within 6 hours. So make sure you're monitoring for bleeding. So there is a medication are preventing clot, and this is thrombolytic medication. Which patient you will give them? When they are coming with MI patient, heart attack, pulmonary embolism, you can give them and monitor for bleeding. So we finished page second is the one. The first one we talked about the insulin and hormones. Second is your cardiac package. Make sure you know some of your drugs, and very important, monitor your patient. Let's take a quick break and then we will start the third package.